All right, so whilst we are waiting for others to join, maybe we can start with the introductions. Just to introduce our facilitator, and then also to know who's online since we are not many at the moment. So I'll start by introducing myself. And I'll introduce the facilitator briefly, and then he'll speak to his own self-introduction. And then we'll hear from you where you are joining us from. All right, my name is Gina Teddy, and I'm one of the lead for the Sister Africa project, which is basically trying to promote health systems and policy research across the continent. And not just that, but promoting particularly systems thinking. So we do this sometimes in collaboration with other networks who are interested in similar things. And we realize that most of our practitioners, policymakers, researchers, and also students who are training under most of these subjects and who work and require systems thinking approaches, although may know the subject or may require systems thinking, tend not to apply because the context within which they work do not support some of these things. So it makes it in such a way that as much as we are seeking for funding and we are introducing new intervention, the effects of some of these interventions are not very sustainable. And so they are very short-term effects. And sometimes they also don't get buy-in after funding had finished. And for that matter, we thought that once we do a systems thinking approach where it is embedded within it a sustainability approach, these decisions, projects, programs, and interventions that we undertake, either as with whatever capacity that we find ourselves in, will be much more sustainable because we use systematic approaches to do them. And that is the whole essence of SISTAC's work, to promote that process. Bearing in mind that there are variations in doing this across different contexts. Can I kindly ask all of you to mute yourself as soon as you enter? And if you are driving, that's fine, but kindly mute yourself so that we can have a good discussion. All right, so with that said, myself and my colleague Dintley, who has just joined us, have been working around the systems thinking acceleration for Africa, and with the support of Emmanuel and Andy at the moment, who support us administratively. We work with other people who have the expertise in the kind of capacity that we want to build, and that is how come today we have John, who will be introducing himself. John was very kind. He actually trained recently, which I was part of it, in terms of how to write a case study. And I really enjoyed his presentations. And then we are also working together on one of the projects, which is Recover Project. So then John decided that he was going to support us with the training. So most of the time, it's difficult to get someone to train you on case study writing or how to disseminate what you have written. So please, let's use the time well and take advantage of having this opportunity to be on this training program. On that note, I hand you over to John. But before then, I'm going to ask you to have a quick round of your name, where you are joining us from, and why you are interested in case study writing. Just a brief statement so that we don't spend all the time doing other things. Okay, can I ask who wants to join? Who wants to introduce themselves now?
Hello. Good morning.
Hello. Good morning. We can hear you. Go ahead.
Yeah, I'm Dr. Adeniyi Ogini. I'm a public health physician and the executive secretary of Osun Health Insurance Agency in Nigeria. I work in the area of healthcare financing now, but I have my PhD in ecology and environmental science, and I've been doing quite a lot of things in the health financing, landscape in Nigeria, and I would like to disseminate some of those information and some of the lessons learned from the things that we have put in place. That's why I'm interested in doing this case study design webinar. Thank you.
Thank you. That's fantastic. Thank you. Can we have the next person? Amy.
Good morning. My name is Amy Techi. I'm joining from the Secretary of Directorates from the central region of Ghana. Occasionally we do some operational research, and I think there's a good opportunity to also learn about case study dissemination, and that's why I joined. Thank you.
All right. Thank you very much, Mimi.
Hello, good morning.
Good morning.
Yes, I'm called Matthew Ndiogo. I'm with Church of God Hospital, in Nippon in Kumasi. I intend doing a master's in health service administration at GIMPA this year. So I think I have to prepare ahead so that when it gets there, I can perform better. That's the reason why I'm joining. Thank you very much.
All right. You're welcome. Thank you to have you. All right. Can we have the next person, please?
Hi, everyone.
Hello.
I'm Gottfried Agbala. I'm medical doctor with a public health background. I'm working in un centre de recherche en reproduction humaine et démographie, CERUD in Cotonou. And I'm happy to be with you in order to learn about you.
Thank you. Thank you so much. Could we have the next person, please? Rashida too, can you hear us? Okay.
Okay, thank you, Gina. Hello, everybody. I'm Rashida Compaore, a public health researcher in Burkina Faso, and I'm also a PhD candidate in health policy and system research. So case study is one of the approaches that we usually use in our field. So that's why I want to strengthen my skills in that. Thank you.
Thank you very much. All right. So let's have a look who hasn't spoken. Remy, can you unmute yourself and speak? Remy, can you hear us? Okay, Emmanuel, can you kindly introduce yourself? Your line was very bad, so we hardly heard anything from you.
I am Ambayo Emmanuel, participating from Northern.
All right. Okay, thank you very much. Who else is here? Dintley, can you kindly introduce yourself? Then we'll hand over to you.
Yes. Good morning, good afternoon, everyone. My name is Dintle Mulusiwa. I am a lecturer at the University of Botswana, the Department of Family Medicine and Public Health. I work with Gina on the SysTech Hub, so quite very happy to have all of you. And thank you, John, so much for making the time to be with us this morning, this afternoon. Over.
Thank you, Dintley. So I think we have one more person who just joined. NM Logi. I'm not sure how to pronounce your name. If you can kindly unmute, put on your speaker and introduce yourself. Okay, so I'm not sure. And I think we have Deborah as well. Deborah, do you want to introduce yourself? Just your name and where you are joining from, and probably your interest in case study.
Yes, please. My name is, thank you and good morning, everyone. My name is Deborah Kunedu. I'm joining from Dompase. I'm a nurse and my interest is in research. I'm undertaking a research, so I'm hoping to build my knowledge in research. Thank you.
Thank you too. All right. So is there anybody at all that we've not called or want to introduce? You can go ahead now quickly.
Gina, I see my colleague, Mam Lauzi, but I see that her microphone is not on. I'm not very sure how she joined. Naleji is a nurse practitioner by profession, but she's also a lecturer at one of the local health training institute here in Botswana. She's also a health policy and health systems researcher.
Okay. Then I think I can see, Andy, do you want to introduce yourself to us, please? Andy. Okay, Remy seems to be ready. Remy, do you go ahead, please?
Good morning. Thank you for this opportunity. I am Remy Nyewe. I am an assistant registrar with Simon J. Dombo University of Business and Integrated Development Studies Hospital, WA, Upper West Region, Ghana. I'm interested in case studies because I do a lot of writing and I wish to publish. I know case studies are also being published, but I need to be able to do it well in order to attract a very good journal to publish what I have developed as a case study. So this is an opportunity for me to learn, and I believe I will be able to do some case studies. That is what I do and what others do. Thank you.
Thank you very much. So I think we can stop here with the introductions. If you haven't, towards the end, we will invite you to just quickly introduce yourself because people will keep joining. So we didn't finish with the introduction. So yet again, John, thank you so much for agreeing to do this for us. And of course, you can hear from them, from the introduction, how much people are looking forward to learning this skill. So I'm going to hand over to you in terms of the case study. And I want to say that John is an associate in ITM, and he's going to speak to us about what he does and why he agreed to do this, because he's somebody who we know is capable of doing this. So over to you, John, your audience.
Thanks a lot, Gina. Good morning or good afternoon, everyone. Remy, maybe can you mute yourself, please? Because we hear a lot. Yeah, thank you. Can you hear me?
Yes, we can.
Okay, perfect. I'll put on the camera for a second as well. So good morning or good afternoon, everyone.
Good morning.
Thanks first of all for giving me the opportunity to be with you. As Gina said, I work at ITM in Antwerp, the Institute of Tropical Medicine, in the Health Systems and Policy Research Group we have. And so systems thinking and health policy and system research is very much at the core of what we do. And through our group and through the 1L network, the network of West African leaders in health systems and policy research, we came to know each other. We came to know Gina in the context of the Recover project, which focuses on collateral effects of COVID-19. And voila, that is why we're here today to have a closer look about on what we understand of case study design. English is not my first language, so if something would not be clear, please do ask questions, do interrupt. There, I'd like maybe to ask Gina to follow up on that, because I've seen there have some things that have changed in the settings, and if I'm sharing my screen, I'm projecting the PowerPoint, I cannot follow up on the chat. So please just give a shout when I need to pause when something is not clear.
All right, John.
Great, thanks, Gina. So yeah, I will do that then. I will start sharing my screen so we can take off. Voila. Is it visible for everyone?
Yes, it is.
Yes, it is.
Okay.
Yes,
Excellent.
it is.
Excellent. So, here we are. So, when we talk about case study design, we're focusing on a particular phase or a particular step in the research process. The second step, we might say, after we have identified the problem, we defined the aims of our study, we framed the issue, we explained what our positionality is. So it's focusing on that second step of the design aspect of it that we will do during this talk. We won't go into the details of the or the practicalities of data collection and analysis, because as you will see at towards the end of this presentation, the analysis of data is no different than what we do with the regular research methods that we know. So here we're focusing on the design stage. Why do we opt for a case study design as compared to other possible designs that are out there? So case study design in the broader context of health systems and health policy research, it has a dedicated chapter in that reader of Lucy Gilson that you see projected on the slide, and it is considered as one of the flexible strategies through in the design process or in the research process, as opposed to fixed strategies. In fixed strategies, we establish our methods before our data collection, and they can be standardized in a way, like big quantitative survey research would fall under that. But in flexible strategies, those are not standardized, and those can evolve during the study. That does not mean that we won't develop a study protocol, because that will still be very helpful in structuring and organizing our research, but the protocol can be changed over the course of time according to further insights that we gain in the process. And it's totally fine to do that within a case study design, as long as you're transparent about it, as you communicate clearly about the choices that you make, and if you justify them. So the data collection can change according to the emerging insights that we gain throughout the course of the study. So the case study design, what are we talking about? What is it? First of all, it is an empirical inquiry. So it is a design that allows us to collect primary data. What do we do? What do we study? Well, we study a certain phenomenon that we have that is of our interest in its real life context, in real life settings. And it is particularly useful when the boundaries between that phenomenon and the context are not clearly evident. To give an example, if we look at, for instance, at well-performing hospitals in a certain area, and you ask ourselves the question, yeah, why is that the case? Is that the case because of certain practices that are going on in that hospital itself? Management practices, leadership practices, how the work is organized and distributed? Has it to do with broader context phenomena, such as living in a setting with a lot of financial means and resources? So what is it that exactly explains the well-functioning of that hospital? And what we will do in the case study design is to disentangle that phenomena from that context, and considering the context as a part of the explanation of what we study. So that might resonate already with a lot of you that are involved in health systems and policy research, because exactly in health systems and policy research, we look at complexity. We look at dynamic and complex situations where multiple variables interact. And it is the configuration, the dynamic interaction of those variables within a context, with the agency of actors, with structural limitations, with the issue of emergence, things that pop up throughout the process, that exactly will be very, for which exactly the case study design will be very useful to look at it. Because the case study design takes a holistic way of looking at things. It is a holistic approach, and it allows us to study something such as the performance of a hospital from different angles, from multiple angles. And if we look at a case in a more holistic way, we will come to a better and a deeper understanding. But of course, we will have to do some boundary work because we won't be able to look at everything at the same time. And what we will try to do during a case study is to put bits and pieces of the puzzle together. It might still be a little bit abstract what I'm saying now, but it will become clearer throughout the course of this presentation. So, what's in case study design? What are we exactly talking about? In very simple terms, case study, that's the study of the case. And basically, that is, we're trying to make sense of something that is of interest to us. And that is at the same time the most difficult question that we will have to answer in the case study design. What is it that is of interest to us? What do we mean then by case? And in short terms, a case in how we understand it is a topic, a phenomenon. For instance, training processes in your research institute. Phenomenon can be democracy, performance management, leadership, maternal mortality. The phenomenon of interest is the case, which makes it already clear that the case is not a geographical setting or not a particular hospital. I will come back on that later. So the case study is, in a case study design, we will explore a particular case into depth. It is based on detailed field work by researchers, and it is also method neutral. We don't give preference to one method over the other. We can combine quantitative methods, qualitative methods, different kind of sources to make sense of the phenomenon that we are studying. So sources such as policy documents, interview data, surveys, observations, we can use all of that together to come to a deep understanding of what we're studying. Where does case study design come from? Well, it has a long tradition in history. Mostly in the social sciences. It has roots in anthropology and sociology, but then also in all of the other disciplines that you see listed up there, from history over psychology, political science, and so on. And it is very, and those different disciplines are very useful, because as we will see, in case study design, we advise to start from theories, from theoretical propositions, from hypotheses that will be informative to design our research. I will come back to that in a second. Just to make it very clear, case study design at this point is not how we use it, or a case in plain English, at the case of Senegal to study a particular health topic. That health topic as such is what we define by the case. So when are case study designs useful? What can you do with them? First of all, you can use case studies to explore something. If you want to study something that you don't understand very well yet, for instance, because it's something new that is happening. And the first months of the COVID pandemic, we did not know how to take care of patients in primary healthcare sector, and we want to have a look at that. But a case study can also be used to describe something, to give a detailed description of something of interest. For instance, in COVID times, when we already knew a little bit how to go about it, then we digged into studying how primary healthcare centers adapted themselves after COVID has been around for a while. And we can also, in the third place, use a case study design to explain things. For instance, why is it that the first line of primary healthcare has become more proactive to deal with pandemic threats? I see that there are some issues in the chats. Okay, we will come back to that later on. But let's write them down, and we'll come back to that in a minute. So the case. What can be the case? What we said it's a topic of our interest. It's phenomenon that we're interested in, and what can it be? It can be a lot of different things. And the driving force there is what is of interest for you. It can be a particular issue. For instance, we want to study suicide amongst indigenous populations in Malaysia. It can be about communities. It can, for instance, be the community resilience towards climate hazards in the coastal areas of Mozambique. It can be about individuals. For instance, how do individuals cope with gender-based violence or with family violence, and how does their care trajectory through the different services, from police services to health services and so on, takes place. We can study occupations, for instance. We look there, for instance, at the task shifting in obstetrics from gynecologists to midwives. That can be the phenomenon of interest, and what the impact of that is of that on the midwife profession and the training. It can also be an event like a hurricane or typhoon itself, and how does that relate to sexual and reproductive health rights or maternal mortality, the interruption of the continuity of care. It can be even about a music festival, for instance, and how that can be informative for health promotion and so on. So it can be many different things, can be defined as the case. So it's very broad, but what do all of these things have in common? Well, the study object is always in some way related to people, to their relations, to their interactions, to their interpretations of actions. So we're talking about social actors in context. And there's that interplay between those actors, their agencies, the structural limitations, the context, that will be the puzzle that will explain what we are looking at. So we're talking about complexity, we're talking about adaptive behavior, we're talking about emergence, all of the things you know from health systems and policy research, and it is that complexity that we try to unravel in the case study design. And the individuals are studied in their natural setting. It's about their social interactions in their natural settings. But as I earlier said as well, it can be very confusing. And even one of the main authors with respect to case study designs uses the word case in different meanings throughout his textbook. And it's that textbook that has been used a lot in this presentation as well. So in his textbook, on the one hand, he uses it to refer to the issue that we study, but also to a field site and so on. But to make it clear, here we do not refer to the field site, so we don't look at the case of Mauritania, for instance, to teach health system strengthening. No, the topic of investigation is what we consider to be the case, and that can, for instance, then be health system resilience. What are case studies also not? Well, case studies, or what we don't consider in our presentation, our understanding to be the case studies is the ones that are defined or used in business literature. For instance, the Harvard case study design that is used to teach business management. So there it is about an educational tool. For instance, the case of the company Coca-Cola. That is not what we understand by case here. Any questions so far?
John, I have a question, but I think maybe you could address it perhaps a bit later, because it was on an earlier slide that you have with regards to flexible designs and issues of ethical clearance, so that when you are in the field and you change your data collection approaches or methods, does that have any implications in terms of ethical clearance? But maybe you can address it later when you come to that.
Well, with respect to ethic, and that you will see in case study, there is no difference as the steps you would need to follow in other settings, but that is indeed something that might raise sometimes an issue with. It depends on your ethical clearance board, and it's partly depends also for who you're interacting with. So the advice there would be is to take your entry point or your starting point as broadly as possible, and if you use if you base yourself on theory, that is just what makes what allows to prepare for the possible ethical issues that you might encounter during your research process. When we talk about an ethical flexible design, we talk also about the fact that your main focus of study, your main phenomena can switch during the course of study. I will come back to that in a second, but it is indeed an issue that not all of ethical committees have the same level of experience with, but the same holds for how you conduct then ethnographic research or grounded theory research with you. And so the same principles that you have to take into consideration there, you have to take in consideration in case study design, and try to think as much beforehand as possible, and grounding your work in pre-existing theories might be useful for that. Does that make sense? Is that?
Yeah, no, absolutely. Thank you very much.
Okay, so so the case study, so as I said, it relies on multiple sources of evidence, and we will triangulate our data. We will use different sources and bring them together. And the decision we take in case study design is, first of all, a strategic decision about the scale and scope of the research that we will do. So it's not so much about the methods in itself, and you will see partly already the challenge of the question about ethics that were just raised there. But it's not like, for instance, a lot of epidemiologists do, that we look at a certain thing, for instance, suicide, and they use their epidemiological toolbox to to study that phenomenon. And that biases the study already in itself, because by the tools that you use, you keep out of sight, possibly out of sight, a lot of things and a lot of possible alternative explanations. To give an example of that suicide study, often we look then at what are possible risk factors for people to commit suicide, but other dimensions, and in indigenous in suicide with indigenous people, for instance, one of the explanatory factors is the interruption of their cultural continuity by colonizing powers, is one of the explanatory factors in the disproportionate levels of indigenous suicide, which would not come up if our first decision that we take is our epidemiological toolbox that focus on risk factors such as alcoholism, violence, depression, and so on, that explain suicide. It's because we need to look under the surface. And that's what we do in health systems and policy research. We look for explanatory configurations between actors, their context, interventions that might try to solve the issue. So we go beyond those risk factors approaches. We look for explanations, we look for determinants, we look for determinants of determinants. And so the starting point about in case study design are not the methods. We can use all of the methods we want, but we take a strategic decision about the scale and the scope of the research. And in the example I just gave from those indigenous suicide, that can be, for instance, the raising levels of indigenous youth suicide in Amazon adolescents in a particular part of the Brazilian rainforest, just to give an example. But of course, to come up with that idea, to understand that cultural continuity as a concept, as a mechanism, can explain why indigenous populations commit more suicide, that comes not out of nowhere. That comes out of theory, about ideas, about theories that has been developed in other disciplines, in anthropology, in sociology, not necessarily in mental health disciplines, and we use that theory to study our phenomenon. And then we dig into the body of knowledge. We dig in the body of knowledge that is already out there, and then we use those kind of theories to look at a suicide in this case. So the definition, so the benefits of prior development of theoretical propositions to guide our data collection and analysis is what really makes a case study worthwhile doing as well. Is that an obligation to start from those earlier theoretical propositions, from those theories? No, that is not the case. You can also take like a more inductive approach, such as is done in grounded theory, for instance, and when you really dig, start from the data, and you merge yourself into the data, and you come up with the explanations from there on. But as there are already so many things that are thought about, that are published, and not only in public health, but in all of the different disciplines that public health uses, it might be very useful to start from that knowledge base, and then to test, to falsify, or to refine that knowledge base that is out there. Okay. So by that, I already partly answered this question here. Why are case studies particularly useful in health systems and policy research? Well, health policy and health systems issues, they're context related, and they're complex in nature. It is about actors, it is about our relations, it is about emergence, it is about structure, it is about agencies, it is about stratified realities, it is about the interplay between all of that. And the case study design is then a good fit because it is flexible and it is context sensitive. And we can use the flexibility and the context sensitivity of the case study design to justify in our methodological or in our research design section why we opt for using a case study. So up until here, it was, let's say, a broad introduction about why case studies could be used, the justification of why they could be useful. Now we will go through the different steps on how we can go about it, and in which the things that I've earlier said will hopefully become a little bit clearer as well through practical examples that will be given. But I will just want to check as well if there are additional questions at this point.
There aren't any on the chat, just a request for sharing the slides, which we will definitely do even as we send out the certificate.
Yes, I will send you the slides as well after this.
Yeah, thank you. You may continue.
Okay, thanks. So, so the steps in developing a case study, the steps we're focusing on here is on that part of that design phase in your study. So previously, you already have defined the problem, the aim of your research. You have clarified your positionality and so on. Okay, so the first step is to identify those theoretical propositions. To be clear, it is not an obligation, but we believe, myself and the colleagues from my group, that it is an interesting starting point. So what is a theory? Sometimes also referred to as a hypothesis, as a theoretical framework, as a program theory, theoretical propositions in the terminology of Yin, the author of the case study design book. Well, it is a story. It is a hypothetical story about why something occurs, about why we see the things we see, why a phenomenon occurs. Why do we find that that theory? Well, we just look into the literature on the one hand, and as I earlier said, don't limit yourself to just to look into the public health literature or public health databases. It can be very informative to look, for instance, in public administration literature if you want to study governance issues, because governance is something that has been applied in many fields. We can learn from other sectors as well. Systems analysis is also something that we can look at in educational literature, policy transfer, traveling policies. Sometimes the terminology is different. So let yourself be inspired by the literature from other fields as well. Or if it is a topic that has not been researched a lot, you can still use that literature from other fields and you use it in a creative way. If it's already researched a lot, you can build on that literature that exists to refine it, to test it. And if not, if we don't have a lot of literature on the topic we're studying, well, you just try to build up a commonsensical reasoning, an analysis of why do we see the things we see. So you ask yourself the what, how, why, where questions, and you can also draw on implicit theories, on folk theories. In the example of the indigenous youth suicide that I earlier gave, you can talk with community leaders on on why they think that is the case. And then you can take that as a starting point to test and to study. So drawing on that theory is what typically differentiates case study design from ethnographical studies or from grounded theory studies. So why do we think that starting from theory, from hypothesis, or from theoretical work is useful? Well, it can help you in defining the questions. If you know what is already been out there and what's already has been studied, and from which theoretical perspectives and entry points, it can help you in define the question and refine your research question from the very start. It also helps to in identifying the case, the topic of investigation. Think back at the boundaries work that I explained earlier. What is it that we are exactly gonna study? We're looking at the performing of the well functioning of a certain hospital. Certain hospital in a particular context works very well. We want to know why. Depending on the time and the resources that you have, there are many different entry points that you can study there. We can decide that our cases be the leadership or the management practices as part of that big explanatory puzzle in the well-functioning of that hospital. So starting from theory can also make your research more manageable, because from the literature, from the theories, we know that leadership might have a positive impact on the performance, and so we start from there. It is also helpful to start from theory in your analysis, because you don't have to start from scratch. You can use coding trees. You can have categories from concepts from the literature that can help you code your data and see things that you find back or that you see contradictorily, and then you falsify theories that were already published out there. And it also improves us, helps to improve the transferability of our findings. One of the issues why case study design, and especially by quantitative researchers, is often criticized is because it is supposed not to allow for generalizations. It is said to be remained only focusing on a particular setting, on a particular context, and we can't learn anything from that surpasses that context. But that is not how we understand cases. In what those critics say, then they refer to a case as, for instance, a particular hospital in Accra. But it's not that what we mean. We don't look at what happens in that, or we're not interested in what exactly happens in that particular setting or in that particular hospital. That hospital would be our unit of analysis, but not our case. Our case can be the management practices and how they feed into the performance of that hospital. So what we're interested in is, for instance, how leadership is key in defining the performance. And then which kind of leadership, for instance, if it's top-down leadership, if it's distributive leadership, if it's charismatic leadership, and so on. And how that interplays with context. For instance, we can have individualistic cultures versus collective cultures, which will have an impact on how leadership generally is perceived. So what we're trying to do here is focusing on how leadership, our case, helps to explain the performance of a hospital. But we're not talking about that particular hospital in Accra or Cape Town or wherever. It's in the definition of what we understand to be a case that comes the possibility to transfer lessons to other settings. And then we can, if we find in Accra that leadership or charismatic leadership is a key explanatory mechanism to say that the hospital is functioning well for that reason, then we can look in another setting, for instance, in Dakar, is that still the case here? And is that still the case considering all of the other contextual elements that are at play there, because it can be another political environment, other policies, and so on. So we're looking at an explanation of a part. We're looking at parts of the puzzle that can help us explain something, and the generalizability to say to say it in statistical terms, but we speak of transferability, lays in that explanatory mechanism that is on a level or higher level of abstraction. We're not focusing on the particular micro setting. We try to abstract, we come to a higher level of reasoning, and we take that explanatory mechanism to another setting, and we test it there, or we refine it. And then we feed with that new research again into the literature, and so we build up gradually our body of knowledge. So the statements we make are about a particular topic, in this case, the impact of leadership on the performance of hospitals, and not about a particular setting, a particular hospital in Accra. That hospital is not our case, but the leadership practices are. So cases can then be more or less concrete. They can be more concrete. We can look at the coping behavior of victims of violence. We can look at the life histories of delinquents. For instance, we can look at the health system resilience in the context of climate hazards in Maputo. It can be about community resilience towards those climate hazards. It can be about occupations, the example of task shifting in midwives I gave earlier. It can be about a particular event, for instance, the Cuban Missile Crisis in the context of nuclear threat back in the 80s, if I'm not mistaken. So it can be about many things. So the case definition is guided by our research aim. What do we exactly want to look at? What are we interested in? By our research question, and then by our hypotheses or theoretical propositions. So I hope that by this time it is clear that the case is not the geographical site, the study site, that the case is not, and that the case is neither our unit of analysis. The case is not Accra, and the case is not a regional hospital in Accra neither. A question. I see a hand raised.
Yes, thank you, John. Just for the definition of a case here, when we talk about multiple case study, what is the multiple cases?
I will come back to that in a couple of slides.
Okay, thank you.
Okay. So if you look at that, that's something that you will come across with a lot in the literature as well. As an example, an evaluation of immunization programs in primary school children in the case of Senegal. I hope that is clear that in our understanding of cases, that is not how we would phrase it. That is how cases often used in plain English, but our case here would be the immunization programs in primary school children, and so not Senegal. Let's now maybe look into, or let's look to an example to make it a little bit more practical and clear, hopefully. So the study of urban health governance. Our research question is, and people that are familiar with realist evaluation will recognize where this formulation of research question comes from or is inspired by. How, why, and in which circumstances does the interplay between governance and community self-organization lead to improved public accountability in health service delivery in slums in low and middle income countries? That is our research question. Then what could be the case in this when we look at this research question? Is the case the multi-level governance system? Is the case the community self-organization? Or is the case accountability in slums? What is the case here? Well, actually, all three of them could be argued to be the case. It is a very broad research question, so you can take different angles to study that, and you can also decide where you want to focus more on. So if the focus, for instance, is on the governance system, then you could argue that the community self-organization is part of the broader context that will be informative for the functioning of your governance regime in the slum. So we look there at the configurational aspect in which our case is the governance system and how that works. And we have all kinds of explanatory mechanisms that are floating around it, let's say, and community self-organization is then one of them. But it can also be that our interest lays in the interplay between that community, between that governance system and the community self-organization, and that we look at accountability more in an outcome type of way. And thirdly, it can also be that throughout the course of our research, and then we come back to the flexibility in our design, that we want to shift actually the focus of our research from studying governance to community self-organization, because we see that a lot of things are going on there that might be very interesting to delve into, might be very explanatory for our research questions. So we shift focus and we take community self-organization then as our main, as our case, even though we had started by studying governance even if we started from governance as our case. So that is the flexibility that the case study design allows you to do throughout the course of your study. So graphically, and in a couple of slides, we will come then to the embedded case studies. So we see the case as a topic or the issue under investigation. It is not the research side. And then we study that topic within a broader context. If we take back the example of urban health governance that I just showed on the slide. So the case here was defined as the urban health governance system. That is the case, which we study in 3 sites. We study it in 3 cities, in Accra, in Cape Town, and in Bangalore, India. And what is the unit of analysis? Well, the unit of analysis is the local health system, or an urban local health system, which is defined by administrative boundaries. And we study 2 of such local health systems per site. So in every city, we study 2. So what we study here, we have a multiple case study. We study the same case, the governance system, but in multiple sites, in 3 cities in this case. And we look, our unit of analysis is the local health system. We could have looked at the governance system of tertiary care, for instance, but here we define it we defined that our unit of analysis is the local health system, and we look at 2 such unit of analysis per site. So those unit of analysis are embedded in each site. So here we have an embedded multiple case study. It is multiple because we look at the same topic of investigation, our case, in different sites, multiple, and within our unit of analysis, we have 2 units of analysis within each site. So, and these are then embedded in that site. Is that clear?
No,
Yes,
really, please, could you
absolutely.
explain the issue of embedded? Can you please explain it a bit further?
Yeah,
You're talking about
sure.
embedded multiple.
Yeah, for sure. So embedded, what does it mean? Embedded is, it lies within something, right? It is,
Okay.
So we look, for instance, if we take another example, you look at the functioning, the performance of a hospital. You look at the performance of a hospital in one area of the city as compared to another area of the city. Yeah. So that city would be then our study site. For instance, Cape Town. We look at the performance of a hospital that is in a richer part of town, and then the performance of a hospital in a poorer part of town.
Yeah.
But we study that. We study the functioning of those hospitals within the broader geographical site, which is Cape Town in this case. Okay. So our units of analysis, our hospitals, are embedded within Cape Town.
Yeah.
And it's important to study or to look at that embeddedness, because the city of Cape Town and the local policies and the local governance structures and so on will be a part of the explanation. It will not be enough to look at the study or the functioning of a hospital in a richer setting, in a poorer setting, in more generic terms. The fact that they are embedded within Cape Town and not in Conakry or not in Bangalore or not in Accra is part of the explanation. So that embeddedness is important.
Yeah. It's okay. Thank you.
Great. Other questions? No? Okay, so what is the advantage then of organizing or of such a design? Well, first of all, we can compare our different units of analysis within the same context, within the same site. We can compare the urban local health system 1 and urban local health system 2 within Accra. The context is the broader context is the same, but we can compare those different units of analysis. We can also compare across context. We can compare between Accra, between Cape Town, and between Bangalore. So overall, we can build more explanatory power in. We have a refinement of our analysis. We have more explanatory power. What you might possibly find in literature or when you read studies is that they talk about within case and cross case analysis. But actually, it should be better to talk about within site analysis, within study site analysis and cross study site analysis, because case is the topic and not the geographical setting. So when we talked about the boundaries of our case, we will need to take a couple of decisions. We need to take decisions about what's in and what's out of our case studies, because otherwise it becomes unmanageable. Unmanageable our study. So we will have to define which people do we look at? Which kind of professions do we look at, for instance? Which kind of organizations do we look at? Do we look at hospitals? Do we look at primary healthcare centers? Which kind of issues do we look at? Resilience, how do we understand resilience? Performance management, leadership, which kind of leadership do we look at? Do we look at their interplay? And also, in what time periods do we study our things, in a pandemic times or outside of a pandemic times, in a financial crisis or not? All of those things will have an impact, and that's so the time can be an important contextual variable that explains your data as well. But as I said, case studies in the literature, the terminology might be quite, or the use of the terminology might be quite confusing. Let's take the example of this paper from Bergen and Weil. Their case study, the topic of investigation, is about the case management, and you see the case management cases here understood in a different way, but the management practices of community nurses with their patients. So they focus on how community nurses deal and work with their patients. The unit of analysis here are the practices of those individual nurses. So they look at how do nurses deal and work with their patients in a broader policy context, organizational context, and so on. And actually, they look here, their unit of analysis, or their subunit of analysis, as put on the slide, are actually two things. On the one hand, they look in their study on the practices of individual case managers towards the nurses, and on the other hand, on how community nurses deal with their patients. I just put on this example to showcase that the use of case studies, what counts as a case in the literature, can be very confusing. So you always will have to look back on how you define your case and try to make a sense of what the other authors have written. There is no standard definition about or standardized practice about how case study design should look like. So what we're presenting here is also what myself and my colleagues understand of it. Another example, this example comes from a big multifaceted intervention to strengthen the implementation of evidence-based interventions and responsive care to reduce perinatal mortality and morbidity through a multidisciplinary approach in Benin, in Malawi, in Tanzania, and Uganda. One of the cases here is the study of the relation between mentoring and coaching practices. You see that on I don't know if you see my mouse moving, but on this part, the midwifery training. So the relation between the mentoring and coaching of midwives and the quality of care is the topic that a part of the researchers of this bigger research project are interested in. So this is the case. So case studies are conducted within the context of a broader research project. It is a multiple and embedded case study. It is multiple because we have 4 study sites, and in each of those study sites, we look at the same case. We look at the relation between the mentoring and coaching of midwives and the quality of care. The 4 study sites here are 4 countries: Benin, Uganda, Tanzania, and Malawi, and our units of analysis that are embedded in each of those countries are 2 hospitals. We look at 2 hospitals per country. And the ultimate goal or the aim of that research was to find out about how the intervention was carried out, how it was interpreted and experienced by doctors, midwives, and so on. So you can have case studies within a broader research project, and within which those other dimensions or those other working packages of the broader research project can use perfectly other kinds of study design and methods as well. So the most difficult step in case study design is the definition of the case. What are you gonna study? What are you gonna look at? And if the case definition is not clear, that is the boundary work I referred to, we might have some problems, because the things that we find might presume to tell us something about our case, but actually talk about something else. Are we really studying governance, or are we studying something else? Are we really studying leadership practices, for instance, or are we studying professional cultures and dynamics between different professions? And if our cases are not clear, of course, the comparability between the different settings might be impossible. So the case definition, as Ian argues, should follow logically from the nature of the research question and the theoretical propositions. It focuses on the presence of characteristics of interest, and it might be needed to change during the study. For instance, we decide to focus on that community self-organization instead of on the governance issue. So the next step, step 3, is then to choose the study design. Overall, we can choose between a single case study and a multiple case study design. Here they're just put out in some graphics. So because we have seen that before. So the single case study is we look at a certain phenomenon in a particular context, and that's it. For instance, the teaching of research methods at my institute at ITM, and our context would then be what are the European educational policies that are there, what are the accreditation policies, what is the institutional requirements, what are the institutional requirements of my institution, and so on. Yeah. So then the multiple case study design, that is basically a combination of different single case studies. The case can still be the teaching of research methods, of health policy research methods, for instance. But then we look at that and how it is done at Serut in Benin, how it is done in Gina's Institute in Ghana, how it is done in different in the School of Public Health in Mexico, and so on. How can we categorize single case studies if we look at them? But that is something really, it's well, this part is not very important, but just for the sake of comprehensiveness, I'll briefly go over it. So first of all, you again see the confusion here. The single case study, then Yin talks about the critical case, the unusual case, or the extreme case, the common case, revelatory case, and longitudinal case. but actually it would be better to talk about a critical case study site or a critical case study, but not a critical case. And why is that? Well, critical cases and revelatory cases are a little bit the same. That are case studies that are essential for your field of study and for the future research. An example, we're looking at a hospital in the north of Peru that works particularly well with respect to maternal mortality, and we ask ourselves why is it? And we see we don't have knowledge about that. So the critical case study site in this context is a hospital that performs particularly well with respect to maternal mortality. And a critical theoretical proposition might then be the importance of cultural competences or traditional birth practices in that hospital that lower cultural barriers for delivery and that avoid obstetric violence, that are actually a good example of respectful maternity care, and that makes people go to that hospital. And then if something goes wrong, they are already in a hospital setting, and so the emergencies obstetric care can be put into place quicker. So the cultural barriers that were uplifted is actually what explains that case. And we started from noticing, in that hospital, the things seem to go very well. A longitudinal case study can, for instance, be the studying of the development of the 1L network, of the emerging leaders, or the leaders, of health systems and policy research over the course of 5 years. How does that network of health professionals develop over the course of 5 years? An example of an extreme case study, if we take again the example of the research method course, can be, we have a master's program in public health, and we see that even though on average all of our students perform very well in all of the courses, but then in that particular research method course, they underperform. And then we look into that, and then we ask ourselves, why is that? Why is that? But what we actually look at, the phenomenon of study of interest, is the performance of students, right? That is our case, and then our unit of analysis would be the health research method course, and not the universal health coverage course, for instance. So our unit of analysis is the health methods research course, and the case is the performance of students. So the advantages of such multiple case study design, they're very self-evident. It allows us to build stronger evidence. It allows for the replication, so for a stronger theory testing. And we can, in the selection of our in the selection of our study sites or the selection of our unit of analysis, we can play around with it so that they can contrast each other, or that they can make our results stronger. So we can build on the results from one study site for the refinement of our theoretical propositions and then test them in another study site, or we can also contrast two very opposite hospitals, for instance, that do completely different with respect to their performance, even though in a lot of other context variables they appear to be very, very similar. So then we look into that. So overall, it allows us to get us stronger evidence, or in statistical terms, stronger external validity. But the downfall of it, we need extra resources and extra time. So then embedded case studies with multiple units of analysis. Embeddedness then refers to the fact that you will study things in the same context. You're embedded in the same context. You study, for instance, governance. The context can be ACRA. The unit of analysis one is one local health system, urban local health system, and the unit of analysis two is then another local health system. So multiple in the single embedded case study, we have multiple units of analysis within the same single case study. It can be one hospital with several units, or it can be one development program with several projects and so on. But the risk, if we look at things in that way, is that we start to focus too much on the different subunits, that we go too much into detail, and that we lose the overall holistic approach to explain the things we see. So be a little bit careful with that as well. And the multiple embedded case study, the advantages, it allows for a refined analysis, it allows for replication, but the downfall of it, even more resources and time required, and the risk that we focus too much on those embedded units. And then here you see an overview of the previous slides and the choice, which kind of approach that we take. It depends on our research question, it depends on our theoretical propositions, but there are also pragmatic reasons in it, such as our resources and the time we have available. And it can often be that we start from a single case study design, and then with more time and more resources becoming available, that it evolves into a multiple case study design. Gina, yes.
Thank you, John. I was hoping that if you don't mind, if you can give an example side by side between the multiple case study versus the embedded case study. Because I think if you look at it in the diagram that you have on the screen at the moment, it looks like the same when people want to apply it. By natural sense, it's not. So if you can give one typical example versus the other typical example, I guess people will be able to differentiate between them very clearly. That's if you don't mind. Thank you very much.
No, sure. No worries. Well, can you see my mouse moving?
No.
Okay. So if you look on the right hand part of that slide, the column multiple case designs.
Yes.
First, our case, let's say our case, the topic that we're interested in is the governance, governance issues. Context one can be Accra. Context two can be Cape Town. Context three can then be Cotonou, and context four can then be Dakar. Those are the contexts. We study governance in that context. And what is our unit of analysis there? It can be regional hospitals. Regional hospitals in Accra, in Cape Town, in Conakry, and in Cotonou, and in Dakar. If we look then at the slides under it, with the embedded unit of analysis 1 and 2, our case can still be governance. Our context are still those 4 cities, but we have 2 different units of analysis. It can be that our unit of analysis is regional hospital on the one hand, versus a local hospital on the other. And we do the same in all those 4 settings. So we have an extra layer of analysis, of in-depth, because we can compare regional hospitals with primary healthcare. What we do then, we don't only study governance in a particular context, in a particular urban context in this, but we also take the particularities or the characteristics of the kind of health service, in this case, a hospital versus a primary health care setting, into account, and how governance plays out in those different units of analysis. So it's actually additional layers of comparison or of in-depth analysis that you can bring into your study. But in essence, it is the same. We do case study design, we use multiple methods, we look at the complex puzzle of all different kinds of variables, of explanatory mechanisms, of the interplay with context, of the importance of the behaviors of human beings, what about the things that facilitate their behaviors, what limits their behaviors, and so on. And the level of nuance that we bring in, that can differ. But in essence, the case study design as an overall approach remains the same. Does that make sense?
Yes, it does. Thank you very much. And just to emphasize that it's the complexities between the different cases that makes it embedded or multiple, right?
Well, multiple is, as the word says, you have multiple settings, right? You do the same thing in multiple contexts. That's what you do. The embeddedness is about within each of those contexts, what are you exactly looking at? And there you can look at different kinds of health services, for instance, or you can look at the same kind of health service but in different parts of town. So then the unit of analysis is mostly defined by the characteristics of the neighborhoods more than by the characteristics of the health service. That can differ. But it's whatever you decide that you want to look at, and what you're interested in, and what you start looking at as well. Then and then some of your analysis, some variables or some elements will be considered to be more contextual and less the main focus of what you're looking at. But then in another research, it can be the other way around. You know, what was context in one becomes the main focus of your research. But from a complexity perspective, we always look at these configurations of this interplay between all of those elements that are at stake. And we have then things that emerge, and we have an open systems approach. So things happen and have an impact that come along. So in any way, we'll look at all those elements anyway, or we try to look at them anyway. But wherever the focus lies of our particular research, we zoom in according to what we decide to zoom in. We have the total freedom to do that, as long as it's clear for the reader what you're zooming in on. So what your case is. For that, it is for that reason, it is very important to define actually what your case is. But from that systems approach, those other things will always have a role as well. It is about the decision on where we decide to zoom in on.
It's very clear. Thank you very much.
Thank you.
Hello.
Can I continue?
Yes. Hello.
Yeah.
Yeah. Can I ask something, like, to say from experience? Do you think the embedded multiple units of analysis, looking at the one that has analysis 1 and analysis 2 in all the 4 contexts, do you think it's easily doable? And is it sort of like consumer friendly, the end user? Do you think the product will actually drive a point home for the end user? For the researcher, well, it's their job, they understand what they're doing. But for the end user, do you think it can actually bring the desired deliverables without any confusion?
Well, yeah, that ultimate design, which is also the most time consuming and the most costly, helps you to do is to refine a lot more and to have a lot more contextual information and contextual explanatory power as well. It depends in the same way who actually the end user is, if it's about a local government or if it's the national government or is it an organization as a WHO and so on. It really depends on who the end user is as well. What the ultimate the design allows for is more refinements, more in depth, more information. Of course, at some point you will see that you will come probably at the saturation as well of if there might things that you see that occur over and over, and then you can decide, okay, I know enough and I'm going to start focusing on another research topic. But in principle, that more complete design, let's say, allows for more information, for more in-depth refinements. That's basically it.
Okay, thank you so much.
Okay, let's continue maybe. So then the fourth step of the data collection, here we can go over fairly quickly, because here the case study design is no different than what you would do in any kind of research. As I said, case study design is method neutral, and whatever data collection method you will choose will depend on the research question and on the theoretical proposition. So quantitative and qualitative data you can combine. To come back to the study of suicide, you can combine epidemiological data with then in-depth ethnographic research. The same holds for if you want to study health systems resilience. You can use all kinds of resilience measures, and you can use qualitative data as well. You can put into question the usefulness of the combination of those data. It's in no way different than in other research, the use of your data collection methods, or the choice of your data collection methods. And the same holds then for the data analysis. You simply have to stick to the rules for the data collection methods that you have used. So if you use quantitative data, you have to stick to your statistical rules from that method. If you use qualitative data, and it's more often in case study design, we use qualitative data. What we do is we go through them, we read them, we think and rethink, and we draw them out, we visualize them, the same as what you would do in any kind of qualitative research. So Yin, what does he gives us 4 options when for developing our analytical strategy, and we can combine those options. So we're here on the level of the data analysis, and the first one, as I said in the beginning as well, is to start from those theoretical propositions. So use concepts from theories, use theories to describe your data, to categorize them into themes, and then to refine them to go into a more in-depth analysis of it. So case study design is an overall design. And then what Yin recommends here is what you would do in any theory-driven kind of research. And any research that starts from theory, that is no different than what we do then in case study design. But if we have, for instance, if we're having to do with a critical case or with a phenomenon we're not very familiar with, we can also opt in our case study design to take a more descriptive approach. So we really spell out exactly everything that we see and what is happening, because the theories are not very developed, or we don't know which possible theories we might use. It's all still a little bit blurry. So instead of going to that explanation and to that theory refinement part, which is the one that was listed in the first option, we opt for a description. And in that description, we can use frameworks that can guide us to structure all of the data that we see, or that can help us describe dimensions we can look at. For instance, in ITM, we have the Health Systems Dynamics framework, but the WHO has the Building Blocks framework. And then we can use that to analyze the impact of global health initiatives on our health systems. So we're not looking for causal explanations per se, or we're not on the level yet of what are the things that really can explain the things we see. We're still on a level or on a step beforehand. We describe whatever we see that is going on, and to structure our descriptions, to not having to start from scratch, to knowing which chapters we can describe existing frameworks, which are not theories, but can be useful for that. Of course, we can also decide just to start from our data and to develop all of the codes and to develop our own coding scheme ourselves, emerging from that data. So that is what is done in ground with theory and in all of this qualitative approaches that start from the ground up. That's taken an inductive approach. We start from the data, we look for patterns between them, we categorize them, we group them, and then we ourselves develop concepts and possible frames, starting from the data. And a fourth and a very, very important option or actually approach in or strategy in your data analysis is always look for plausible rival theories. Don't take anything for granted. So let always the data speak. And do not necessarily try to push your data into the different theoretical propositions that you have had. So be careful of confirmation bias, of seeing seeing the thing that you want to see because the theory says so. No, always think, I see something here. Okay, the theory, it might be explained by the theories from this body of knowledge, from this literature, but are there other possible theories that might explain the things I see? And then you can develop that in your discussion section, or you can develop that already in your data analysis part. But then you need to be critical about the data that you see. So be careful not only to stick to the theories and that you have used and the theoretical propositions that you have used, but always ask yourself the question: what are other possible explanations for the things that I observe? That might be very evident in one way, drawing on other kinds of theories from, I don't know, if we looked at governance, for instance, mostly from political science perspectives or public administration perspectives, but what does the economic literature tell us about it and how they explain it? But it can also be a more something that lies under the surface, and that is not very visual. One example of that is when they studied the performance of they looked at racism in British hospitals in the UK, and they could not find from a very empirical level any racism going on there. But when they digged deeper, they saw that there was the culture of professionalism that made that nurses were not racist towards doctors from non-UK's origins, but the professional culture balanced out their racist behavior. But if we looked at the nurses amongst themselves, there was a high level of racism going on there. So that means that there is an other thing, professional culture, that then explains the fact why do we see racism or not to occur in those British settings. So dig deeper on the one hand and look for rival theories on the other hand. And that can be the subject also for future research, of course. Your discussion part can be the starting point for further research and for new grant proposals that you write. So in case study design, generally, what are we aiming for? What are we looking for? We're trying to make inferences. Inferences, what do we mean by that? Well, we try to establish causal links. Causal links about the things we see. We have we see something happening. We have observed events. We have certain outcomes, and they're happening for something. They're happening for a reason. At least that's what we try to do often in public health and in health systems and policy research. So we look for those configurations that can help us explain why we see the things we see, and we do that on the basis of our data, like in the other kind of research. And the question that we then have to ask ourselves, of course, is that inference correct? Does charismatic leadership leads to better performance of hospital, or might be the performance of the hospital, might it be explained by something else? That then would be the rival theories we're looking at. Is the evidence convergent? Is all of the evidence we find, is that pointing to the same into the same direction? Don't leave certain data or information out because it does not fit within your previously defined theoretical propositions. So here we're talking on, are there alternative or rival explanations that we did not take into consideration yet? So basically, we're talking here about the quality of our analysis. The more statistical people would talk about the internal validity. Here we talk about credibility. So are our findings justified because of the right use of the methods in our data collection and in our data analysis? And how can we improve throughout the process that credibility or that internal validity? Well, pattern matching is one thing. We seek for patterns in our observations. If X happens, then Y happens. We look for patterns in our data. We look for patterns across study sites as well. So we take a higher level of abstraction. We don't look at everything that is going on in that particular hospital of Accra, but we look on the higher level. What is the causal mechanism that can explain what is happening in that hospital in Accra, and that can, for instance, be the leadership, that can be the organizational culture, that can be anything you deem relevant. And then with all of this, we put all our info together and we come up with a configuration that is an explanation. That is an explanation of what we see. We identify and we try to rule out those rival explanations. We use logic models, or we use theories of change, we use our theoretical propositions, and we triangulate our data. An interesting thing to do is to look for settings that apparently are examples of the opposite of what we see, and then go with our theoretical toolbox and with our case study design toolbox there and see what and see why it is the case. A well-functioning hospital versus a badly functioning hospital. One of the challenges also in case study design, you have a lot, you engage with your data, you have you have a different exercise of reasoning going on to look for that configuration, or that for that explanation and that causal configuration of things. So you use a lot of different data from different sources. So document your analytical process as good as possible to be able to track back your reasoning, that your reasoning does not pop out of nowhere. So document well the different steps that you do in a logbook, or for instance, to make sure that you can trace back, especially if you go over your analysis over the course of a couple of months. So external validity, that has been a long-standing point of critique, especially by quantitative researchers that say that case studies are only anecdotal and case-specific, and therefore don't have a strong external validity. But I hope that at this point it is clear that it is actually a ridiculous comment, because case studies don't apply the concept of statistical generalization. Case studies use theory and test theory. We are talking about the issue of that transferability we talked about. We make statements about theories and not about a particular setting. For instance, why would one of your research institutions be interested in studying the evaluation of a course of a master's program in public health at my institute at ITM? Not because we would not be able to say anything more generic about what is happening at ITM, because we don't talk about that course as such. That is not our case. Our case would be, in this case, would be here, adult learning processes. And then the theories of adult learning and how they play out or not in our particular setting of ITM and the Belgian and European educational landscape, that might be informative for your own settings. For instance, that good adult learning is informed by selection processes of students. That good adult learning and adult learners, in order for them to be motivated, they need to have autonomy over the learning processes. It is that level of generalization on the level of theory and of theoretical explanations that we aim for in case study design. So whatever your context is, you can learn something about the case study of the evaluation of a course at my institute, because we're not talking about ITM in this case, we're talking about adult learning processes and what makes adult learning processes work or not. And of course, my particular context will have an impact on that, and part of that context explanation will be the selection processes of the students, which kind of profiles come in, which background, which methodological background do they have, and so on. But it is still informative on a higher level of abstraction. We can learn something that might be applied that might be informative for the development of educational courses in other settings. And in that sense, the case study design aligns very well with all of our complexity and context-sensitive thinking and theory-informed research that we do in health systems and policy research. So the comparison between the empirical findings and initial theoretical propositions that allows for drawing conclusions at a higher level of abstraction. That is what I just said with the example of the adult learning process. So we do generalization, but our generalization is not generalization in statistical terms. It is an analytical generalization. It is a generalization on the level of theoretical explanations about explanatory mechanisms. Because we started from theoretical propositions in the first place, and then during our data analysis, we confirmed or we or rejected those propositions. We search for new elements, and then we roll out rival theories. So the core idea in this case study design is we eliminate the general by looking at the particular, but that particular can be very informative. So our theoretical propositions, where we start from, let them guide you, but not blind you. That is a very important thing to take into consideration. And with that analytical generalization, in the case study design, we try to eliminate a part of the complexity puzzle. And so it does not claim to be representative for everything in all places at all times, but it is a stepping stone for future research and explanation. And that configurational thinking has multiple advantages. First of all, one of the advantages is equifinality, which means that we can have multiple pathways that can lead to the same outcome. We can have multiple causal explanations that explain the well-functioning of a hospital. And what we do in our case study, we will probably zoom in or use or illuminate a part of it. That can be leadership, but it can be something else. And then through the different studies, when we put everything together, we will come to a more nuanced understanding of why that is the case. But as opposed to in very surface level, empirical, variable-driven research, which does not allow as much for equifinality, what we can do in case study design, we can have multiple causal pathways that lead to the same outcome, which at the same time allows us to distinguish between which causes, which variables, which mechanisms are necessary and which are sufficient to explain the outcome we see. And it also allows to take the time dimension into consideration. We talk about path dependency. We don't only study our issue in a particular context, in a particular setting, but also the timing when that we study something is important. Are we studying something in the context of political instability or not? Now we have a new geopolitical context going on with new nuclear threats, considering the war in Ukraine and so on. So the timing of when we study something is very important, which in a surface level variable-driven statistical research is not always taking into consideration. So to sum up, in single case studies, we look for analytical generalization, that is the generalization to the theoretical propositions, not to populations, as epidemiological research tends to do and experimental methods tend to do. And we try to aim for a replication logic. Replication logic is that the results of our first study are used to compare, to be compared with other study of the same topic, but in another context, and that can be then used to refine the proposed theory. We can have a literal replication, where the case study designs reinforce each other and show similar results, or we can have a theoretical replication. We're studying the same phenomenon, performance, but we look at a high-performance hospital versus a low-performance hospital. But our case remains the same. That is the performance, but the replication is theoretical because we look at the high-performing versus low-performing, not only at high-performing performers amongst themselves. And if the cases then do not produce the results as we would expect them to do, then our initial theory, explanatory theory, should be revised, refined, and tested, and continued. And here I come at the last part of that presentation. So the reporting, actually, I will go very quickly over it because you have different ways on how you can go about the reporting. First of all, in your reporting, make a clear distinction between the evidence, between the description of the data that you have found, and then the interpretation of it. What could they mean? Make sure that you distinguish that very clearly, that because the interpretation, that is your role as a researcher. The data are data that should be able to be analyzed by other researchers as well, and to see with whatever interpretation they come up with. And then if you write your case report, if you write it out, you can structure it in different ways. You can do it in a linear way, which is more the structure that we know from public health journal articles, with an intro section, a background section, a method section, and so on. You can take a chronological structure in which you mostly focus on the different phases of the study. For instance, if you start from a certain in the realist evaluation of a certain intervention, and you start from your initial program theory, you work with that, and then you come to a refined program theory already after having analyzed part of your data. That is a more chronological structure that is based on insight that comes along with your data analysis. You can have a comparative structure. For instance, if we look at the importance of community resilience of community self-organization, and we want to make sure that the visions and the ideas of the communities are not lost in the whole of the analysis, in which policymakers or others might have a more dominant voice, then we can dedicate particular sections to the different actors to make sure that is highlighted. We can use a theory building structure to demonstrate how little by little we are refining our theory based on the insights that come along. We start, for instance, with the analysis from one unit of analysis, make that dialogue with the literature. Then we go to the next, refine the literature, and we do it then step by step. We can take a suspense structure in which we basically start with the results, with a very innovative or message that is more like newspaper-like, and then we explain our how we came to those results, or we can have an unsequenced structure, which we only would do in single case studies, and that allows for more creativity. But then in the reporting, that is something you have completely freedom about, as long as your message you want to convey to your reader is clear, and how you present your report as well will depend on the audience you are targeting as well. So yeah, I think that is it for my part. If there are any questions, I will be happy to see if I can respond to them.
Thank you, John. This has been very, 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 how should I call it? Very educational and also very in-depth. And you've taken your time to explain a lot of things to us. So I guess the floor is open. If you have any question, kindly put your hand up and then, or just unmute yourself and go ahead and speak.
Well, thank you.
So that John can address. Okay, go ahead.
Yeah, well, thank you, John, for this insightful presentation. I want you to guide me on this. I have an intervention to make medicines and consumables more easily and readily available at health facilities that are accredited under the health insurance scheme, particularly public health facilities. Because the problem we have in Nigeria is that most of our public health facilities do not have enough personnel. They do not have enough, medicines and supplies. And so it's a discouragement from people, to get into those facilities to get care. So at the Health Insurance Agency, we started an intervention of ensuring that we established a drug distribution center. In fact, the only one of its kind in Nigeria. Now we have been collecting data on the utilization of medicines and the supplies in those facilities. Now, I want to document this and I want to publish. I want to disseminate what we have found from this intervention in making medicines and consumables more accessible or more available in government facilities. How do I go about it in the context of what we have been taught? I hope you understand my question, John.
Yeah, well, first of all, I would start by describing clearly what you have done, right? How the intervention works, what you have done. Also, then you need to look at what do you see as a result? Do you see that there are any changes in the use of medicines amongst the people?
Yes.
And then if that is the case, or if that's not the case, you can start to ask yourself why do we see the things we see? We're looking here at the use of medicines or the availability of medicines, because that's still a difference between the two things. It's not because medicines are available that people will use them.
It's availability.
It's availability, and then you can look and you can see if you, for instance, you study the availability of your medicines in one particular context, in one particular city, and you study them in another particular city. Are there differences? What can explain the differences? The difference can be explained, I don't know, by it's not my field, but it can be explained by how your organization works, which kind of it can have to do with the management structures, which kind of barriers are there, which kind of facilitators are there. I would look into other kinds of studies that have looked into that. The idea is that with this case study design, of course, not everything you can also develop your you can observe, you can make interviews, you can make surveys and so on, that gives you an idea about why the things worked or not. But It is very informative, firstly, to look at other studies and other settings, how they have documented and which kind of explanations they have come up with, and explanations that are on a level of an explanation that you can do something with, right? You know, if it's about management practices, yeah, but which kind of management practices? Is it about team compositions? Is it about who has the decision-making power? Is it about bureaucratic barriers? About what is it exactly that is the case here? Is it about if you look at the health systems blocks, is it about financing barriers? So what you could do here, as part of your analytical strategy, is to document your case, to describe your case, and you can describe your case because we're looking here at the pharmaceutical system, let's say, and you can use that by using a pharmaceutical systems framework or a health systems framework, and then you apply it to the availability of medicines to already come to an understanding, like a broader picture. You write everything out. That does not mean that you already are on the level of a causal explanation, but it might give you hints to what might be causal explanations or what might be barriers and facilitators. But if it's new, mapping out, describing well your intervention and your case can be the very first step.
Thank you. Thank you. Thank you. Over.
Okay, is there any more questions? Is there any more questions? All right, if there is none, I guess we are still just about within time. So I take this opportunity to thank you all, but particularly to thank John for his time and his dedication to supporting us, especially with regards to doing this case study. This is something that sometimes when people start doing, it can be daunting. And I guess I have learned a lot as well, even though I teach this and I guide students during supervision to apply this. It has always been also educational for me to refresh my memory and then to clarify some of the questions that I have that prevents me from maybe really being able to go down to the nitty-gritties to explain things. I'm sure some of you will apply this immediately and others wouldn't. But it doesn't mean that you should forget about it. But it would be nice if you use this in any way, if you could let us know what you are using them for and how you are using them, just so that we know if we are making impact. So with that said, I think this has been very educational. This has been very participatory as well. People had questions, they wanted to clarify issues, and that responses had come through. So I'd like to encourage you to use the knowledge as much as I will be using it for multiple things. And just so that we'll continue with some of this capacity building, because we can see it's making an impact. Gina, so with that said, I'll invite any questions from, any comments from Dinky. Yes, sorry.
Gina, please, I've sent several emails to you. I've sent several messages through your PA to you on the after the last two webinars that we had. And I was trying to engage to let you know what I'm doing and seek your guidance, but none of it was even acknowledged, not to talk about, reply.
Oh, I'm sorry. I haven't been receiving any emails from you.
It's a pity. I copied the email from the advertisement.
Then maybe it went to the you call it email. It might have gone to the email, the Sister Africa email. So we'll check on it and get back to you.
Please do. Thank you very much.
I don't have one. So I'm sorry if you have been responded to.
It's okay. Thank you very much.
All right, okay. So is there any other thing? Otherwise, I'll invite Dinkley to make a comment.
Thank you, Gina. I don't have much to say, just to again echo our gratitude to John, but also to colleagues that attended with us this afternoon. Like Gina was saying, we would want to really continue engaging with yourselves. Those of you who may not have yet joined SysTech Africa or have contacted us via the Hive, we encourage that you do so. So you could always send an inquiry either to Gina, to myself, or to Emmanuel if you have any points of clarification. But just to really say that, you know, what we are really trying to do here is to just build this community of practice and to really encourage cross-learning amongst ourselves. And we would really love to hear what people are doing in their various settings, particularly if people can also talk to how they hope to be able to use this learning in terms of what they are doing. Some of you that are involved in research, in terms of the sort of research that you are doing, just so also that, you know, where there are opportunities, we are able to connect each other to opportunities and other networks that exist there. But once again, John, thank you so much for making the time and really providing us with this in-depth learning that you shared with us this afternoon. Back to you,
pleasure.
Gina.
My pleasure.
Dr. D.
Allow for the recording so that we can share this on. Yes, so there will be, the recordings are usually uploaded on our YouTube channels. Emmanuel, who's recording at the moment, will be doing so. And we have also other recordings of webinars that we have done online. So kindly us and engage and listen to some of these things, quite educational training programs that we have.
Yeah.
Somebody.
So Gina, and I also just, oh yeah, sorry, Kozi, go ahead, sorry.
Yeah, Dr. D, I just wanted to find out, because there was mention of a YouTube channel. So I just wanted to know if what is the name of the YouTube channel, so we can search for previous webinars that you've uploaded.
Right.
Is it on SysTech Africa?
Right. So
yeah,
the what do you call it? The certificates when we send it. And please, if you don't send us your email, we will not be able to send you the certificates and your full name. So kindly, as much as you can, if you want, it's not compulsory that you will give you certificates. If you want some certificates of attendance from us, this is something that we do to encourage people, because some people need, this is not accredited. Even if it's accredited, it will be within the jurisdiction only. But we do give certificates for you to, you know, encourage you so that you can use it also for your own other promotions or what have you that you want to do. But these are really well thought out, you know, webinar series to build your capacities. So please, if you want the certificates, send your email in the chat box, because we download the chat and then we just send it to those who email are in the chat box. And that is because we are not allowing registration per se anymore. We allow people to join us and when they are ready to join our webinars. Thank you so much. Dinkley, were you saying something, or can I close the session now?
No, just to remind people that we aim to do this every month, every third week of the month, just so that people, even when it comes a week before, that's something that they are also planning for in their usual calendar.
Exactly. So it's third week in the month. So we'll try, and if there is any cancellation on us, which happens because we are working with people, we will also let you know.
Yeah.
All right. Okay, on that note, thank you everybody for joining. For those of you joining in Ghana, I want to believe it's raining across the whole country. And for those of you joining us in other places, we are grateful for your time. And we hope that you learned and enjoyed the session that we had morning. All right. So on that note, thank you, John, and all of you have a nice.
Thank you as well. I hope you all have a nice afternoon.
Bye. Thank you, John. Bye.
Bye. Take care.
Bye, John.
Bye. See you next time.